Hello, my name is Jasim from Jasim Al-Mosawi's Counseling. In this video, I'll be exploring discussing some technique related to driving and anxiety. In the previous video, we talked about type of driving anxiety, symptoms of driving anxiety, and we provided some technique about driving and anxiety. But this video will talk more detail, we'll focus more on detail about technique to help with the driving anxiety. So as we know that when a human face with danger or faced with fear, their body normally respond in a three way. Their body respond either into fight or flight or freeze. And these are the three natural response that we have in our body, that it's built in our brain, that built in our amygdala, that help us to survive. So when we think about a dangerous thing, or when we perceived a dangerous situation that might be coming in our way, our body respond into one of these things. And in terms of the flight and fight, they call them fear of mobilizations, or respond of mobilization, respond of movement. The person run away, the person fight, becoming aggressive. That they call them mobilization, fear of response. Or when the person go and respond into a freeze, I'm not sure what to do, they call that this response is called fear of immobilization. So the person freeze and unmobilized, the person stay in the same place, they're not sure what to do. So in order for us to help individual deal with anxiety, driving anxiety, we really need to work on one of these fears, these responses. These responses that has been built in the person's mind and has been intensified as a result of motor vehicle accident or bad experience. And so what we need to do first, we need to set up some goals, and a very important aspect in setting goal, that the person one of the goal is that we need to work on the issue of avoidance. A major issue in a driving anxiety, that people flight, run away, or freeze. Sometimes they go into a vehicle and they freeze, they don't know how to respond, they don't know how to drive, they feel they forget everything in the vehicles, they don't know what to do, they freeze. Sometimes people lose some fluid, like body fluid, while they are in the vehicles as a result of their nervousness. So we need to work on the issues of avoidance. But how we work on the issue of avoidance, we really need to set some goal with the individual, a gradual goal, to help them face rather than fight. Face the fear, face the worry, face the perceived fear that as soon as they sit in the car, they will lose control and they will have another vehicle and another motor vehicle accident, or they will be involved in another motor vehicle accident. So that the fear that they have, the perceived fear. So we work on that by helping the individual build a connection with their vehicle, maybe gradually cleaning the vehicle, sitting in the vehicle, starting the engine, driving slowly. But again, we cannot force a person to sit there, because they will be freeze. We need to build a gradual response, gradual, step by step, almost like climbing a ladder. We need to take one step, then the next step, the third step, slowly and slowly. And we know that when we're taking the 2-step up, maybe there is 1 step down, maybe 3 step up, maybe another step down. So we need to work on that with the patient to help them reach their potential, reach their goals in the driving. And so technique that will help a person dealing with that goal of being in a vehicle is taking a deep breath. When the person in the vehicle, the person need to take a really deep breath. One of the best technique to take a deep breath is just to put hand like this, cross like fingers, put them behind the back, and take a deep breath. Sometimes people say put their hand like on one hand on the chest, one hand in the stomach, and take a deep breath. But that's actually gonna force the person to breathe from their stomach, which cause more problem for them. But when you put your hand like that and put them behind your back and take a deep breath, that's actually physically shifting your body, forcing you to breathe from your stomach. That's one of the techniques that will help to that's it, to help with that setting goal. The second one is helping the person to feel around them, become very mindful, become very alert, drinking some water, listening to a music. These are techniques that can help. So these are techniques that can help when the person in the car. However, there is other technique that it can need to be worked on when the person outside of the car. So for example, when the person is not really involved in any driving, the person need to work on their negative thinking. So the person with fear, with anxiety, with driving anxiety, often receive a lot of messages from the brain to tell them there's some accident gonna happen again. There's a lot of bad negative messages the person will be receiving. So we encourage the person to work on interrupt this negative thinking, stop this thinking by self-talk, telling themselves that I know I am a good driver. I know that I'm not going to get involved in another motor vehicle accident. I know that motor vehicle accident could happen to everyone. So self-talk that can help interrupt that negative loop that going into the brain, that's sending all of these bad messages to the person. So these are a few techniques. Exercise, very, very important. Exercise is increase the level of the dopamine and serotonin in the brain that can help the person relax. Again, driving anxiety, a major stressor for a lot of people, and a lot of people have been struggling with it. But really there's a lot of support, and we really encourage you to reach out and work on your issue with your mental health therapist, and discuss driving anxiety, and maybe other anxiety that people have. People have some illness and anxiety, especially with the corona right now, with the COVID. A lot of people are afraid of getting sick. So that's another issue that related to anxiety. And also we can support people to help them. Mental health therapy, one of the best technique that can help people manage these anxiety. So we wish you the best with your driving. Take it easy, take it one step at a time. Try to take care of yourself, do some self-care, exercise that can help you a little bit with your driving. Okay, and we will be providing more technique, more videos in the upcoming day about driving anxiety and other things. Please follow us at Jassim Al-Mosawi's counseling at the Facebook account, and also Jassim Al-Mosawi's counseling at the YouTube channel. If you have a question, reach out to us. Thank you.